Hi everyone, I'm Evan from Capillary Physical Therapy here in Malta Ranch. I'm here again with my student Brendan here. So we're going to go over an ankle dorsiflexion or ankle bending test. Very important movement that we should have is something called ankle dorsiflexion, which is just our ability of our knee essentially to track over our foot or our ankle come upwards. When we're walking, running, this is a very important movement, and we should have a pretty good amount of motion that happens there. In a closed chain position, one of the numbers I look for clinically is anywhere between that 30 and 40 degrees of what's considered closed chain motion. So we've already tested out Brendan's left side. He's at 40 degrees, which is I think the appropriate number here. So we're going to kind of clinically first measure this. So how I do this is I'm going to have my patient up in this lunging position on the table, foot facing forward. I'm going to use this wedge to make sure he doesn't pronate or flatten his foot. And what I'm going to ask Brendan to do is to lunge straight forward, kind of tracking over the second toe or middle of his foot, and I'm just going to visually watch that. And I want you to go only as far, Brendan, as you can while you keep your heel down. So you feel like your heel's starting to want to lift there. So what I'm going to do is I'm going to measure that number. I'm going to measure it again just with the bony landmarks that we know. Again, it's the fibular head, malleolus, and then again we're going to go parallel to that. And clinically we are at about 15 to 20 degrees of motion. So I'm going to call that a limitation. So what I can do is I can do a couple things. Manually, I can do my own treatments, but I'm going to teach Brendan a way to do this on his own at home. So Brendan, when we come out, I already have placed here our green band. Black, green, blue bands are usually pretty helpful here. So I'm going to point out a couple of the bony landmarks that are really important here. What you can see is that little bony prominence, that bony bump on the side of your ankle is called a malleoli. And it's again, those long bones of the lower leg, both the tibia and the fibula here, kind of create these bumps. So we want this band to be underneath those bumps, essentially at the crease right where our ankle bends. So what I'm going to do is I'm going to use a stick, and I'm going to have this placed again just kind of on the outside of our foot. And what I'm going to ask Brendan to do is to lunge forward, but have his knee track towards the outside. Essentially, I just don't want him to pronate his foot. If he's really good at his position, I can have him just slowly lunge forward. I only have him go as far forward as his heel can stay down. So I don't want to see that heel lifting up. I don't want to see that arch collapsing. So I'll use some sort of cues or any sort of positional awareness that I can help him if it's tracking in a different direction, or using a wedge to stop that flat foot. But I'm going to have him kind of go forward, holding that position several seconds, and then coming back off of it. And the same thing, I would have him do several sets, several repetitions, multiple times a day. And then again, we would remeasure and reassess that and hope that the motion improves.